So in the school district, like Washington School District, I'll speak to specifically, they have started working with social emotional learning. So in elementary school, where that is the goal, is to really incorporate that so that it's universal, so that students are at an early age learning a vocabulary and also learning skills to sort of take care of their own emotions and that. Then at the middle school level, in this past year, we've had a long-standing partnership, Youth Eastside Services and the Lake Washington School District, but this year in particular, they really stretched and contracted with us to provide 20 hours of behavioral health. So as Susie had said, that's mental health and substance abuse. So it's really the training context that the counselor has coming in more than it is necessarily divides up into those issues at the school, particularly at the middle school level. But they're there and they're partnering and they're working around with the SBIRT effort, the Screening, Brief Intervention, and Referral to Treatment, which has largely been happening in the 7th grade. But that really is looking at where are the strengths, where are the needs? How could we build plans to intervene, both individually, but also what do we learn about our particular schools? So looking at that data, like that point that you just put out with a 39%, but not just like, oh no, then it's like, okay, what can we do with this? Can we partner in the health classes, and can we teach how to deal with stress in a positive way, or what is stress and what's different between stress and anxiety, et cetera. And so they're really very busy doing that, both with the school staff, although, and I think we're talking about the teachers for a reason, because there's been a fair amount of partnering with the school counseling teams, and they've had a fair amount of training, and they're responding to this. But I think that's the place where we haven't really managed to universalize this yet, is with the teachers and that. So these are those kind of prevention efforts that Susie was talking about, kind of starting that out early. So those are some of the things that I'm aware are happening. They're things that need our support at all levels. I mean, a lot of those things are happening because there were people went to the state legislature and said, we need to make a difference for our kids. What can we do? Where is some funding? How can we be supportive of this? And to be able to universalize those efforts. So there is some of that happening.
There's this thing I love about police officers. They're very direct. And I do a lot of training with them, and I will come in and give them behavioral health primers and signs and symptoms and all of this nerdy therapeutic psychological just stuff that I immerse myself in. And I'm usually met with, early on, this face of, yeah, lady, so what? What does that mean for me? What is the practical tool as a police officer that I'm going to take from this to go impart? And to your point, with a 5th and a 6th grader, we talk about these nebulous ideas of skills and stress reduction and, knowing mental health signs and symptoms. But when it gets down to brass tacks, what are some of the things that are tangible that we can do? Teaching at an early age what an emotion is and where it's felt in the body and why they're feeling that way. Here's a good example. I don't watch the news on TV anymore because I got real good at watching the 10, 20, 30-second snippets, and you're having these things go by really, really fast. And then a commercial would come up, and I would sit and I would think, why do I feel so bad? Oh, I know. I just saw 14 stories in about 22 seconds that bleed or plead or are broken, and I get no time or process or reconciliation of that. I just get to see how horrible something was and move on to the next horrible thing. I'd get this gross feeling in the pit of my stomach, and then I'd be done with that news segment during the commercials and go, why do I feel so awful? Why do I feel so keyed up, so anxious, so worried? Oh, I watch the news. Okay, how do I ratchet down from this? And I would have to go back and think about each of the little stories, how I felt about what I saw, what it means in my little world, and if there's anything at all that I could be doing or should be doing, or if I need to just put that somewhere else because that's somebody else's, my favorite Polish proverb, somebody else's monkey, somebody else's circus. But I worked with so many kids and now so many adults that don't have the ability to connect. I am ragingly angry, and I feel it in the pit of my stomach and the tension in my shoulders. Now that I know that I am angry and I feel it in these places, What do I do to resolve that? And that's that labeling, not just what's happy, what's sad, what's angry, what's surprised, what's scared. It's where do I feel happy? Where do I feel angry? Where do I feel anxiety? Where do I feel sadness? Okay, now I know where I feel it. What do I think the source of that is? Oh, I'm fighting with my best friend. I've got an AP test coming up. I didn't clean my room and grandma's pissed at me. Or I am struggling because the girl I like doesn't like me back. Or there's a mean boy bully and I don't know what to do. How do I sit with that emotion where it fits in my physiology, process through it, and that could be just up here, that could be with a friend or a parent, that could be with a counselor or a school counselor or a school resource officer, and then reconcile that to the next piece. That mind, physiology, and reconciliation process for me is something that can be taught at a very, very, very early age.
Absolutely, and I wanted to follow in on that. When kids are in high school, and especially the later years of high school, they do seem to have more symptoms that align with what we might say are anxiety or depression. But in elementary school, kids have anxiety and depression. It shows up differently, though. Kids often will have tummy aches or headaches. And there's, one of those things that I wish I had known as well. But there's research that shows that out of Vanderbilt University, which followed a group of kids, both that had unresolvable tummy aches and those that didn't have tummy aches at all. And they watched them over several years and looked at how many of these develop anxiety disorders, how many develop depressive disorders. I'll let you guess. Of a group, how many do you think those that had unresolvable tummy aches developed anxiety disorders? 50%. Versus a control group of 19%. And they followed the same cohort for for several years. Depressive disorders were not as large, but I think it was 25% to 9% versus the cohort that didn't have tummy aches. They look so different in elementary school. And it's not just tummy aches, it's suddenly they're fighting or they're angry or, they're throwing things. They don't have the tools, they don't have the vocabulary that they need in order to talk about emotions. And I know there's programs coming in like Second Step that's in Lake Washington School District to help talk about emotions, but that is such a critical piece. Balance in Mind started as a way to try to understand where the gaps were and why we were ending up with kids in their teen years that were dying by suicide or, having extreme anxiety and depressive disorders. Out of that, we realized that there actually are a lot of resources in the community, and we just didn't realize that they were there. So we've been trying to connect people with them. But we also realized that parents didn't have a very effective way to get information and to learn about what was going on in the community. And we're in a very high-achieving community, a very high-achieving adult community, which then falls down on the kids. So one of the things that we're working really hard to is to provide parents with information, both parents of elementary-aged kids as well as parents of high school-aged kids. So if you saw this is something that we developed just to start the discussion and to help raise awareness of what risk factors are and what it might look like in your student, whether it's elementary or middle school, high school.
When I was younger, I started first experiencing anxiety around the age of 8 or 9. And like my mom said, it came up with stomach aches. That was the first thing that we realized. And then we started, really dissecting my, I guess they did, started really looking at my actions. And one of the biggest things that I had was separation anxiety towards my mom. So literally, I'm not joking, every single time she would leave the house, I'd have like a full-blown anxiety attack, but I had no idea what it was back then, because how are you supposed to know what you're feeling if you have no idea what it is? And the biggest thing that helped me, because I had to go to therapy, when I was 9, because she put me in it, which was the best thing for me. This is anxiety. Even at such a young age, I was 9 years old. I had no previous conception of what anxiety was, but I gave it a name. I forgot what the name was.
Agnes.
Well, that's my mom's name for her anxiety is Agnes, like literally giving it a name. Separating it, I'm not joking, and separating it from yourself. Being like, this is a thought that is coming to my head. This is not me. This is my anxiety, go away. You have the power to push the anxiety away, you just have to realize that what you're feeling is not who you are, it's these negative thoughts that are trying to go into your head, that are trying to work against you, trying to push you into believing, that your mom's gonna die the second that she goes out of the house without you or without you with her. Or it's, these crazy irrational conceptions that you force yourself to believe in. So one of the biggest things that I think that you can do is really, helping your child understand, that it's not her, it's her anxiety, and also that you're there 100% for her, and just asking, what can I do? What would be the best for you? Because I'm on your side. I want to help you be the happiest that you can be. And just help her realize that you're on her team and that she won't get in trouble for what she's experiencing.
Yeah, I just wanted to touch on a pretty small kind of part of the entire mental health picture, which is kind of the stress induced by school and by academics. That's been a pretty large part of my life, and just coming off of the whole college application process, which was like 10 times more stressful than I could have ever imagined. I think part of it, I don't know if it's a part of what's currently contributing to maybe either your daughter or just kids in 6th grade, their stress, but a big part of it when they get into 7th and 8th grade and in high school is the stress that school induces. And like, I think a big part of that is just telling them and kind of knowing that it's okay. Like, it's okay if you're not getting this certain grade. It's just like a snowball effect. Like, if I don't get the grade on this test, I won't get into this college. I won't get this job. I won't have a good life. And that's kind of a pretty common thought in a community like ours, where we do see all these people with like, those jobs. So I think that's a big part of it, having those conversations really early, like 5th and 6th grade, like, it's okay. We want you to try your best, but it's really okay, yeah.
There's so much implicit pressure, and we always told our kids, whatever you do is fine, we just want you to be happy. Sure. Sure. Turns out we had a lot of implicit expectations of what our children should and shouldn't do. And it's through a lot of work that we have let go of many of those expectations and realized they were ours and not hers. Like going to college. Yeah. And it's part of being real mindful that it is their journey. I am there to support you, but it is your journey at the end of the day. And your journey will not look like anyone else's.
I'm going to put on my educator hat for a second. So I have watched education for many, many, many years. I've seen the pendulum swing back and forth. I've seen everything. I started out as a preschool director, and I preschool teacher, preschool director, and then I taught kindergarten, and then I moved to college. Try that one. So, but what I've seen over the years, and this is what I talk about to teachers, is that we have removed so many things from the classroom that would have helped these kids not to feel so stressed. We've cut down their recess time. We've taken, okay, so let me just talk about kindergarten. When I was a kindergarten teacher many, many moons ago, we played with blocks. It was the year to prepare them to go into academics. Almost all of my kids left reading to some extent just because literature was so prominent in the classroom. I read 100 books during the year. My goal was to read 100 books to them. We learned to get along socially. And so we've taken the very crucial thing that is necessary in our school system to help kids get along with each other, and we've made that an academic grade. And so we have taken, we can bring in social emotional learning now, but in reality, we're trying to put a Band-Aid on what occurred in the first place, is that these kindergartners coming in needed the social experience in kindergarten in order to be able to move on. And so I mean, it is the tide has turned so far that I don't know how we get back to understanding that we've taken the things away that would help this problem at the beginning of their career. I listen to them and I hear the anxiety and the pressure we're putting on children to perform with the tests and everything that we're doing to them. And then we wonder why they're stressed. And so, and anyway, I have stepped up right here to say we need to bring kindergarten back. We need to bring recess back. We need to bring literature back.